Dermatology is defined as the branch of medicine that is concerned with the diagnosis and treatment of skin, nail, and hair disorders. Now, you see, dermatology is not just limited to skin but the appendages of hair and nails as well. Dermatology has various subclinical fields such as the medical dermatology, concerning with the medical treatment of dermatological disorders, the surgical dermatology, the surgical treatments of dermatological disorders, pediatric dermatology, the skin conditions and hair and nail conditions of peds or children. Cosmetic dermatology, or that includes various cosmetic procedures that patients undergo. Aesthetic dermatology, the aesthetic treatments such as the Botox and fillers that patients or people undergo for enhancement of their beauty or beautification. Immunodermatology, concerned with the diseases of skin or hair and nails that are concerned with the immune system. There's dermatopathology, which studies the pathological causes of dermatological conditions. Photomedicine, treatment of dermatological conditions with phototherapy like ultraviolet rays. Dermatoepidemiology, the epidemiological diseases such as leishmaniasis related to the certain epidemiological conditions of an area. And teledermatology, which deals with the distant treatment of dermatological conditions. Moving on to the skin, the structure of the skin. The skin is defined as a thin layer of tissue forming the natural outer covering of a body of a person or an animal. Mind you, it is the largest organ of the human body. The skin is roughly divided into three parts, the topmost being the epidermis, then there is dermis, and the subcutaneous tissue which contains the fat. This is a detailed picture of the structure of the skin. Now here you can see the epidermal layer, the topmost, this is the epidermis. It has five substructures in the epidermis, the stratum corneum being the top one, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. Now you see that the dermis is the only structure with no nerve endings. So basically, when you pinch the topmost layer of your skin, or when you prick the topmost layer of the skin, you do not feel any kind of pain because this is the layer that has no sensations. No sensations of pain, no nerve receptors of pain. Followed by the dermis with the papillary layer where the free nerve endings and the vessels open up. The reticular layer, which consists of all these vessels, shafts and vessels. And then there is a subcutaneous tissue, which is the fat where the arteries and veins originate, along with the origination of hair follicle. We're going to discuss the details of the hair follicle and the structure, but just a brief overview over here. This, you see, is the papilla of hair follicle, and this is the hair cuticle. You can appreciate the hair matrix, and this hole is the hair shaft.
Hi everyone, my name is Avery Raba, and today I'm going to be talking about a career in dermatology. Dermatology is a career in medicine that deals strictly with the largest organ in our bodies, which is our skin. A dermatologist is a doctor who is an expert in conditions involving the skin, nails, and hair. Dermatology is a highly relevant profession that can enhance self-image, worth, and esteem. Why dermatology? Dermatology is more than skin deep. Did you know dermatology isn't just about performing cosmetic procedures? It's much more. Dermatology also deals with skin disorders like psoriasis, eczema, acne, and the diagnosis of skin cancer. As a teenager, I have seen how skin conditions affect my friends' sense of self-esteem because of acne, stretch marks, eczema, etc. They don't feel confident in their own skin, and this affects our ability to relate with others and the environment around them. In a society like ours, image is everything, and to teenagers it's even more relevant and critical. Their future success largely depends on how comfortably they relate with their peers and the perception of their peers. Any skin condition can make them vulnerable. Therefore, it is my passion to help this group of people. Image is also very important to adults, hence that any skin issues need attention. This is why dermatology is important. We all have skin. Most of us, if not all, have experienced skin conditions like acne, stretch marks, psoriasis, etc. in the course of our growth and development. This may have affected our sense of self-esteem and worth and hindered our ability to interact effectively with others. Therefore, skin conditions affect all of us in different ways. With the help of dermatology, people can overcome acne, eczema, psoriasis, skin spots, receive cancer screenings, treat hair and nail disorders, etc. To become a dermatologist, one has to go through rigorous education and training to obtain a high school diploma. One can take a bachelor's degree in biology, after which they can sit for the MCAT exam. Upon successful completion, one can join a school of medicine in any of the academic institutions of higher learning that offer the course. For example, Texas Tech School of Medicine in the city of Lubbock, Texas. Upon graduation, a candidate has to undergo an internship in the Department of Dermatology in any of the institutions, after which they have to sit and pass the Board of Dermatology exam. Once completed, one undergoes a residency program in dermatology in any of the universities that offer residency. Overall, on average, it takes about 12 years to complete education, training, internship, and to become a board-certified dermatologist. 4 years of undergraduate, 4 years of medical school, and 4 years of residency in dermatology. Additionally, one can opt to pursue fellowship in specialized areas of dermatology like surgery, hair transplants, etc. The duties and responsibilities of a dermatologist includes offering skin consultations, evaluating skin through screenings, prescribing medications for treatment of skin conditions, performing both invasive and non-invasive procedures on skin. Some of the skills needed in the field of dermatology include manual dexterity, clinical diagnostics, good communication skills, and knowledge and skills dissemination, among others. The benefits that accrue from being a dermatologist include patient outcomes, vacation and destination places of choice, good health and life insurance, etc. Dermatologists can earn some of the highest incomes in the field of medicine, on average between $260,000 to $500,000 or more with experience. In conclusion, dermatology is a highly relevant an age characterized by a rise in various conditions. Dermatology can help alleviate stress resulting from poor self-esteem and image to different types of skin conditions. For more information on dermatology, you can view YouTube videos on various dermatological presentations. Please pay close attention to your skin. It will reward you later on in life. Seek help from a dermatologist for further consultation in case you experience any of these conditions. Image is everything. I hope this presentation helps to highlight the critical role of dermatologists in society, especially in these times when there is proliferation in skin, nails, and hair conditions. Thank you.